Hi, I'm Erin McNulty. I'm an OBGYN hospitalist working at the Colorado Fetal Care Center at Children's Hospital Colorado. I am primarily responsible for the inpatient management of antepartum, interpartum, and postpartum patients on our unit.
Hi, I'm Heather Buxton. I'm a child, adolescent, and adult psychiatrist working at the Colorado Fetal Care Center at Children's Hospital Colorado. I have an additional area of focus on perinatal mental health and work to support birth parents and families during pregnancy, delivery, and through their potential NICU stay. Erin and I lead a group of providers spanning multiple disciplines at the Colorado Fetal Care Center to address the mental health care needs of our patients and their families.
We provide care for families who have babies that require very specialized care by pediatric providers at the Children's Hospital of Colorado. We provide comprehensive and holistic care for our pregnant patients that includes mental health care.
We know our patients are at a high risk for mental health conditions or perinatal mood disorders, including conditions such as depression, anxiety, bipolar disorder, and OCD. Across all pregnancies, approximately 1 in 7 patients will experience a perinatal mood disorder. Some studies cite an even higher rate than 1 in 7. Data from other fetal care centers shows an even higher incidence of mental health diagnoses in patients with pregnancies complicated by a fetal anomaly.
This is so important given trends we have seen in the United States. In Colorado, death by suicide and drug overdose are the top 2 causes of pregnancy-associated death, making mental health the largest contributor to pregnancy-associated mortality.
Put another way, 1 in 2 pregnancy-associated deaths were associated with mental health conditions or substance use. 89% of all deaths were considered preventable. A majority of these deaths occur postpartum, which means 6 weeks to 12 months after the birth of the baby.
I remind our team that we train for obstetrical emergencies, which are much more rare than these outcomes. So it is so important that we proactively screen and provide support for patients who are at high risk for perinatal mood disorders. We try to prevent these outcomes for our patients, their babies, and their families.
After reviewing this data and screening recommendations, our team has adopted a universal screening protocol for all patients upon intake into our program. Patients are screened using validated tools such as the ASQ, EPDS, MDQ, PCL5, and 5Ps for conditions such as depression, anxiety, bipolar disorder, trauma disorders, suicidality, and substance use.
Screening is just the beginning. Upon identifying a positive screen, our team collaborates with social work and psychiatry to support the diverse needs of our patients. We offer social work support and psychiatric medication management and/or therapy integrated within the Fetal Care Center. We work hard to provide holistic, evidence-based care for the neonate and the patient all under one roof. When the timing makes sense, we also partner with providers in our community to help our patients establish long-term care. We provide warm handoffs to primary providers of patients in the community and all across the country to continue to facilitate their care when they are able to return home.
We know that through an intentional partnership between OB and psychiatry, we can best support the diverse needs of our patients. On this very unique unit, it is so important for us to provide very specialized, up-to-date, and intentional care surrounding the mental health needs of our patients. If you are referring a family or looking for care for your high-risk pregnancy, you can be certain that we will provide care for all aspects of your health at the Colorado Fetal Care Center.
Thank you so much for joining Heather and I today. Our team is very passionate about including mental health care in the treatment of all patients. If you have any questions or would like to speak with our team, please do not hesitate to reach out.